So this is the bulk of my presentation today. So what I'm going to do in the next hour or so, hopefully, is give you an understanding of what 2A is. I'm sure you already know that to an extent by now. But what I'm going to try and do is something that I wished somebody had done for me back when I was in ST2, which is try and be a bit prescriptive. It's probably a bit counterintuitive. I don't want you to think that this is the way you need to do things, but I am going to take an Indian uncle approach to this and basically just tell you what I would do to pass. And if that suits you, you're more than welcome to do that. If it doesn't suit you, hopefully it gives you a couple of ideas of what you can pick out of my strategy and implement in yours. Okay, so just a few disclaimers before we start. We had a wonderful presentation with Michelle this morning. A couple of caveats from my point of view. I might not agree with everything she says, but obviously it is an independent journey that you guys need to take for 2A, and everybody has their own way of doing it. What she did worked for her, and it might work for a lot of people. But I think that's something that you need to decide if you want to take that decision / gamble of not doing questions, of doing it in a different way, because it might even be the better way. It's just about what suits the way you prepare. So I'll go through the standard way of preparation, plus what I would do differently now that we're in 2025, how I would approach the preparation, what resources to use, etc., in a relatively prescriptive manner. And again, just feel free to stop me if you want clarification, if you want to ask any questions, or just drop them in the chat. I should be able to see it because I've got two screens. Okay, so I'm sure you know this by now. So the structure of the exam is now over 2 days. So you've got MCQ style questions, 5 options per question, 120 questions per day, which equates to about 3 hours per day. And you go on to give the exam over a period of 2 days at the same center. And then you find out about the results in about 4 weeks' time. The passing score of the 2A is basically determined by these complex methods of analysis, which involves the examiner essentially saying, okay, this is a question, and I think that if there is a standard average trainee who should deserve to pass, 50% of those people will get this correct. Or, just marking the difficulty of the question, then comparing against how many people got it correct, etc. It's a lot of things that go behind it, which is why I assume it takes so long for them to give the result, even though it's computerized. So technically, you should be able to see your score on the day, but the pass mark would be determined later on. But anyway, that's the way it works. So then the question is, if you've got 240 questions, there's no negative marking, then what is going to be your passing score? What do you need to score to say, I have done the 2A, I can now move forward with my life? This is the graph, which I think really is really good to represent what goes on with, how things are, your effort, the number of people giving it. So let's just break down this graph. Okay. So first of all, the pass mark is 66%. So the passing score isn't high. Technically, if you look at it, you could literally get one question after every 3 questions wrong, out of every 3 questions wrong, and you'd still pass. So it's not too bad. You could literally, technically, if you go blind into the exam, mark everything as A or B, you still have sort of a 50%, 25% possibility of scoring. Maybe even if you were underprepared, 50%, yeah, because you can bring down most of the questions to 2 options. So you technically you can definitely get 50% almost. Okay, so the difference between 50% and the passing mark of 66% is not that big. But what I need you to understand is when you hear about all these stories about people failing, right? There's a lot of people around you who are going to fail. Hopefully, not too many. Hopefully, none of you in this exam. But there's a lot of people around you who have failed who will fail. And the reason for that is not because they were underprepared. It's not because they were not close enough. Everybody, almost everybody I know is literally here, just on the other side of that line. So the difference between passing and failing is really tiny if you actually look at it. So the curve represents the number of people giving the exam. So the most of the people behind this line have failed, but the majority of the number that you get are literally very close to that passing mark. So now, if you look at the effort which you need to pass, this is the blue line. If you continue following that, the pass mark intersects at this point. So if you look at it, it's actually not that difficult. Like the effort needed, of course, it is high, but it's not as astronomically high as, say, for example, you want to score a 95% on the exam, which I'm not sure anybody has ever. But that's the effort. So I just want you to think about the difference between you passing on the other side of this line and you failing on this side of the line, and the effort difference between these. So at the end of the day, you literally have to put in just a little more effort. But the problem is you don't know when you've passed that line, which is why you need to try and aim for something beyond this. Now, you're probably thinking, well, what gives me the right to give you a talk about effort and etc. I passed. But basically, I passed with 82%. That's somewhere around this part of the line. Although I was not aiming for it, I ended up with that score, which means that technically, the way I'm looking at it, I'm a relative pessimist. The way I'm looking at it tells me that I have put in way too much effort to pass, which I could have passed here. And I wasted my summer of 23. I wasted outings, I wasted weekends. So why do that? The reason for that is you never know when you're on this side of the line. You always want to over prepare. And what you study for 2A, as much as they say that this is academic or whatever, theoretical, clinical, etc., sets you up for the rest of your life as a radiologist. The minute you've done 2A, you come into on calls, and when somebody calls you about a question, when you see a request, you immediately know these are going to be the differentials. This is the likelihood. This is the rare possibility. And you're able to provide a better answer to your clinicians, your consultants, everything. So this exam, although it is an exam, is really important for you to understand what radiology is about and how you can be a good radiologist, because you're only good as what you know. So what I'm trying to say is that I don't think it's impossible to pass, but I think it's important to have a streamlined approach. This is my prep in the last 1.5 months of the exam. So I was told by a friend that, there's this app, you're spending way too much time on your phone. Just download it. It's good for focusing. This is the Forest app, if you've ever heard of it. So essentially just turn on whenever you're studying, you turn it on and you let it go. And it kind of gamifies your studying. It helps you focus. It helps you kind of say, oh, I want to increase my time. And for every hour that you study, it plants a tree. So over the 1.5 month that I was preparing intensely before the exam, I spent 344 hours, which were approximately 7.5 hours a day. Obviously, that was not every day. So it staggered the couple of days off, whatever, and it increased towards the end of the exam, as you all would anyway. So I'd recommend that to keep yourself a bit more, accountable initially. But let's start from the beginning. What do I think is the ideal preparation material? Because I don't think that all books are created equal. I know Michelle said that core is what she would prefer, and I understand where she's coming from. Core is great if you like to read a story around things. It's probably not the best if you want to write things down or note things down and revise them towards the end, because of the way the book is arranged. Although it is point-wise, it is very wordy. Whereas crack is literally point, diagram, comparison, done. And I can promise you that having done both of them, Crack the Core has everything you need for the exam and more, but it might not be as conspicuous as you think. So Core might have an entire paragraph about a topic, whereas Crack might literally put it in one line, in a corner, in a diagram, but it's there, and that is exactly what the question is going to come from, because that is literally the high yield question. So, in my opinion, make Crack the Core your Bible for 2025. I know people say it's not extensive. I've told you it is extensive. It's just so distilled to the point where every single word in that is so important that if you learn the book word to word, cover to cover, you will pass. There's no concept building. Okay, I understand where that point may come from, that because it's points, you don't know what the underlying pathology is, but I think he does a good job in explaining what the underlying pathology is at the start of of any section he thinks is difficult. And that's where your other resources will come into play. If you don't understand something, understand the pathology behind it, understand the processes, pathophysiology behind it, go on Radiopedia, and nobody's going to say just do core or just do crack. You need to use Radiopedia, and there's no images, right? So everybody's like, okay, there's no images in crack the core. So it's a very, although FRCR 2A doesn't have any images in it, it's really handy to understand the process or the pathology with images so that you can remember it better and you can actually use it forward for your 2B as well. Now, let me explain what I would do ideally. Okay, so all of those points, valid. I can't, I've told you about the first 3 points, non-extensive, no concept building, need to read the text 2 times, need to read 2 texts. All of that, I think, myths. No images, it's factually correct. There are no images. So what can you do? This is a QR code for a drive which exists. This drive has been created by radiology residents in America, which essentially what it does is, if you know about StatDX, that's a really, really useful online resource. And if you know what Radiopedia. So what they've done is they've gone on to Crack the Core. They've gone page by page and they've said, okay, this is the topic. And now we'll make a PPT linked to that page, which has all the images for that topic. So what that looks like is if you have the PDF for Crack the Core on pancreas, and you open up that text, the presentation slides, it has cystic fibrosis and it's got cystic fibrosis on this end. So it's explaining cystic fibrosis here, and you've got the other PDF open with all the images, and you can do your own markings. It helps you kind of bring it all together. Okay, and if you turn the page, it's going to have images for Shawman-Diamond syndrome. If you turn the page, it's going to have, so it's all linked. The minute you turn the page, it is linked to the chronology of pathologies in Crack the Core. So it's literally like a companion book with images of various modalities for the pathologies that you read in Crack the Core. So that's your problem with images solved. Okay. Now, while we're here, we might as well see how you can utilize this to the most. So you're going to do your markings and your notes on the Crack the Core pages. But what I would also encourage you is that once you've read this and once you open this book, don't look at this and just kind of, look at what they're trying to show you here. Okay, look at what they're trying to show you. Okay, look, this is large bronchi here. There's consolidation. So this is bronchiectasis, upper lobe bronchiectasis. Then you've got constipation, which happens in cystic fibrosis. So this is like a severely constipated abdomen X-ray. Then you've got a cirrhotic liver, you've got recanalized umbilical vein, you've got a large spleen, got fatty replacement of the pancreas, all of that, and you can just mark it yourself. And you've literally, in the span of 5 minutes, read cystic fibrosis and revised it with image input. So this is a really great way of kind of solidifying and keeping things together in your head. Okay? Right. The next thing that I need to talk about is books to do questions. I think that questions are really important because at the end of the day, you could be the best radiologist and you could still fail this exam. It's because it's designed in a certain way that it's trying to test your knowledge, but in the process of making questions, you inevitably enter the territory of the skill of question solving. If you have good knowledge, you might be able to get by, but if you want a better shot at passing, questions are super important because they, first of all, help you with time management in the exam. You understand how quickly you're getting through questions. Second of all, it helps you understand the style of question writing that they have. And third of all, it just gets you into the zone of doing everything together and bringing everything together. Because a lot of times you will read a topic in Crack the Core and you'll go back to the question book and you'll be like, what do you mean? I've literally finished the entire of breast radiology and now these questions don't make any sense to me. I have no idea where these answers are. But trust me, the answers are there. You've read them. The issue is you've not connected that with the way they're going to ask the question. So that connection between your knowledge and the way they ask you the questions is why you need the question book. Okay, so I've ordered these question books in the order of what it is, which one is best and most exam-like, and which one the author just wanted to make you feel bad about yourself. Honestly, like the Oxford one, it's basically that. Like I spoke with one of the senior trainees who had a really good score, and he basically said, I'd almost given up taking the exam because he did the Oxford book. So it's a great one to challenge yourself, but don't let yourself be let down by it. The get through books, gold. So the way they write the questions, the way they explain, the type of options, they are the most exam-like. So if you follow these 4 question books, that will be more than enough for you to pass the exam, along with if you choose to do FRCR exam prep. The way I would do it is, actually, I've got a slide. So if you've taken a picture of that or you've noted that down, I'll move to the next slide. Right, okay. This is my preparation timeline. Like I said, I'm trying to be prescriptive for somebody who might be lost. I'm sure most of you have it all together and you have your own strategies. This is how I would do if somebody said, I have zero idea what I'm doing. I don't know how I should prepare. And this is the timeline I would give you. Okay. You're currently in January now. Okay. So what I would recommend you do is you start, crack the core, read the topics, read the sections, and start doing FRCR exam prep, which is the online question bank. Now, FRCR exam prep is a terrible question bank. Then why am I recommending it? The reason I recommend it is because it is extensive. It may be terrible at being representative of the exam, but it is great at asking you questions on the topics that they will ask you on the exam for. It might not say it in the right way, it might not give you the right options, but the topics that it covers is perfect. So you start doing crack the core. Once you finish reading the topic, or like a section, you go to FRCR exam prep, you solve the questions. Don't just solve them. Once you've solved it, if you've got it wrong, there's a lot of information at the bottom. Make notes from those in your crack the core or whatever, wherever you write your notes, right? Make those notes. So this is the period where you're going to be the slowest. Your speed is going to increase exponentially as you finish this. So you do a topic, you do FRCR exam prep, which is basically one question, write the notes if you don't know the answer, next question, write the notes if you don't know the answer, all of that. So compile all of that together. By June 25, I recommend that you should have finished your first reading of Crack the Core and made your notes from FRCR exam prep. So to do that, technically, you would have to do approximately 2 body systems from FRCR exam prep and Crack the Core per month starting now. Okay, it's doable. It's very doable, but it's still going to take effort. So by June, you finish the first reading and take notes. So you've got all your material together. You've done your FRCR exam prep. you've done your CTC. In August 25 is the last month, sort of, so June to August is your kind of leeway. If you've not finished all the things that you had to by June 25, August 25 is probably the last, like 1st of August 25 is the last date that I would say you should have done that. And then you start the MCQ books. So once you start the MCQ books, you go in the order that I described. But what I would recommend is keep one or two of the question papers from get through for the last week of your preparation or the last 2 weeks of your preparation, so that you go back into exam mode once you're through. Okay. So you start the questions mid-October, you're done with questions and mocks from these books, and the exam is in 25. There are different strategies you can do towards the end of the exam. Maybe I can take a talk on that. But ideally, in the last 2 weeks, you don't want to read anything new. You just want to consolidate your notes. You just want to consolidate your knowledge. And you can keep solving a couple of questions every day to sort of get you into the zone of the exam. Okay, so again, there are obviously caveats to everything. So everybody is different. You could get by with lesser time, but at an increased risk of under preparation. So this timeline I've given you is a safe timeline. If I don't know, I consider myself pretty average with really terrible memory, and this timeline worked for me. So this is a timeline for somebody who probably doesn't have incredible memory, is still unsure of what strategy to take. And the worst case scenario is at least 3 months before you start intense preparation, where you've not done, let's assume you've not done anything and you just have 3 months left for preparation. You just go crack the core and 2 question banks only. So rather than FRCR exam prep, I would recommend Get Through and Master Pass as the 2 books. So you do crack the core and 2 question books only. That is literally the worst case scenario. But at least if you do that, even if you fail, you have a good shot at passing. But even if you fail, you have set up your skeleton of knowledge for your next attempt. So you're not just, trying to get things together for the exam, and then once you failed, you have to start all over again. You've actually given yourself a good head start. Okay, so study tips. Just slow me down if I go a bit fast, because sometimes I do speed up a bit. Right, okay, study tips. This is honestly the single word I can say to you. At the end of the day, you can use whatever you want. You can do whatever you want. The reason you can take any path like Michelle or myself and still pass is effort. You cannot underestimate the importance of effort for this exam. It's going to test you. It's going to make you question why you're doing this. It's going to strain your relationships maybe. But at the end of the day, the one thing that can guarantee you passing is effort. And if you want some help, you can get these. So this is basically what I used for passing the exam. ChatGPT, like I think Michelle gave some really good examples of how you can use ChatGPT. You can use them for making comparisons, for making notes, for clarifying how you go about solving a question. I'll give you some tips. These are the alternative AIs: Claude AI, Perplexity, DeepMind. I mean, pick your choosing. But I think currently, with the model advancements and everything, ChatGPT is probably the best bang for your money. I would recommend getting the premium version for the last 3 months before the exam, because I think that's when you really need it. It's really good for when you've sort of consolidated everything, you've made your notes, and say, for example, you're doing questions, and literally you could have it open as a in the voice mode. So you just have it open, you solve the question, and you're like, I thought I was going to get that correct, but then you got it wrong. So you're like, hey, ChatGPT, why would you have a MCL rupture with a pivot shift injury, and then it will literally talk to you. So if you're that kind of learner who would really appreciate somebody talking to you, it's really good and it's worth the money. So let's go through some examples, right? Okay. So when you're solving questions, this is a study strategy. Read, but ask why something is happening. And if you don't understand why it's happening, go searching for it on Radiopedia or the internet. So internet, I mean ChatGPT as well. So you can ask that, why is there edema in the posterolateral corner of the knee in a pivot shift injury? And then it should be able to explain to you that it's because of bony contusion in the way that the mechanics works. And it's really good at sort of consolidating information and giving you a quick understanding, whereas you'd have to go on Radiopedia, look through pivot shift injury, look through why the posterolateral corner is edematous. It would take more time. Obviously, you would build more knowledge because of all the extra things you read. But if you want something quick, go ChatGPT. If you want to understand completely in depth, go to Radiopedia. And if you want to be a gold star student and you actually want to understand everything that goes behind something, which I highly recommend you do for some things, because Australian trainees have to do that for their exam. They have to understand pathology. So I would strongly suggest, if you have the time or the interest, look up pathology slides for pathologies to understand why things are a certain way. It's very easy to understand why a clear cell carcinoma of the kidneys enhances a certain way compared to a papillary cell carcinoma if you understand how they look on a microscopic level, and why clear cell has a high T2 signal and a papillary doesn't. So all of that together, you just don't have to remember anything if you actually understand the pathology of it. But anyway, that is for the extra mile. Right, okay, this is the example. So say, for example, you don't want to actually go look at a slide. You can just say to ChatGPT, why does a papillary cell carcinoma look low on T2 while a clear cell is high? And it will literally spit out a table. You can say, make it a table, and it will spit that out, say cellularity, papillary is compact, whereas clear cells clear cytoplasm. There's more hemosiderin in papillary, so therefore it lowers the T2 signal. There's low vascularity and low water content, again, lowers the T2. Whereas in clear cell, you've got high water content, high vascularity, clear cytoplasm, which also makes sense because it's literally named clear cell. So therefore, it's got high T2. And there you go. You don't have to remember which one is low T2 again. The next thing is you need to always be thinking about the possible questions. When you study, this is where your question bank will help you. Once you've done a couple of questions or a certain topic from a question bank, when you read that again, or you read another topic, you understand, you kind of get a feel for what they're looking for. And like Michelle said, the most important thing is they don't want somebody who's MRCP to pass the exam. Because if they literally give you, oh, there's a whatever 9-year-old with this pathology, and it's a typical demographic, it's a typical age group, it's a typical presentation, and they give you some imaging findings. An MRCP person could technically give the diagnosis without looking at the imaging finding. So that's what they're trying not to do. They'll give you certain basic demographic details to edge you towards an answer, but the diagnosis will come from the imaging findings. So you need to focus on the imaging findings of something, but equally the demographic. You need to remember that FRCR was something that you would give as a fellow after you've already been an MRCP or MRCS back in the day. So they expect you to have the background knowledge of an MRCP and MRCS with the added understanding of imaging findings. That's the way you need to approach it, with compiling demographics and imaging findings. So these conditions sound similar. Say, for example, you're reading topics and you're like, okay, sarcoid sounds really similar to lymphoma. How would I differentiate between that? Then you could basically create comparison tables. You could go back, read up on them, but you need to know, but once you get an understanding that, oh, they could ask me a question and I'd have to differentiate between these two and I wouldn't know how to, you go and find out how you would do that and sort of make a table by yourself or whatever you prefer, but understand what the differences are. There will be subtle differences. There are three different subtypes, but they're all very similar. Like I said, renal cell carcinoma, you've got five different subtypes, and they're all very similar sounding because at the end of the day, they're kidney cancer. They look like cancer. On a CT, you would just say malignant process, but here they would actually describe it and you'd have to diagnose it. So they sound similar, understand how you differentiate them. Say, for example, it's got the same pathophysiology but different demographic incidents. There's very famously, allegedly in the book, there is something called as the Michael Jackson tumors. I'm not going to elaborate on what they are, but essentially it's the same pathophysiology which occurs in two different demographics. And it's important to know how you would differentiate those again, other than just the age group. Okay, so let's take an example of how you would prompt ChatGPT. What I prefer, my way of studying is I love tables. I love if somebody compares things in a table format because that's the easiest way. I can just look one side, okay, that's the difference. But yeah, so you can say make a concise table with information only relevant to 2A on the differences between. So these are some examples of the tables that I created for my studying. Differentiate between achondroplasia, mucopolysaccharidosis, and the other thing, I'm not even going to pronounce that. And you could create them for Klippel-Trenaunay and Klippel-Feil. You could create them for which ones are autosomal dominant, recessive, or X-ray linked, X-linked recessive, and also the different types of spines that you get. Because sometimes you might go on Google and you search spines, you might have all the different types of spines, but they don't have all the differentials that you need to learn. So this is more an extensive thing. If you get premium, you could even upload your Crack the Core PDF if you have one, and basically say, based on the Crack the Core text, make me a table. So it will basically just go through the Crack the Core rather than anything on the internet, if you prefer to keep it tight. Summarize E. I don't know why that E is there, but yeah, so it's really good for summaries, particularly for conditions. So tuberous sclerosis is one of your very popular conditions that they love asking questions on. But literally, you get tuberous sclerosis in every body system, so it's going to keep coming up, and keeping a track of multiple diseases in multiple body systems is difficult. So compiling it all together in just one kind of table or one page is really useful, and that's where again the large language models can help. It's really good at sort of making things concise, making it to the point, and compiling things together. So this is really good application. Or you could use for Wilson's disease here. I've used Gaucher's, and it's overall what I would say to summarize is it's 2025. You have all these tools to your hand. Use it. They're really good. I do know that they can hallucinate sometimes, but look at it as a summary tool, not as an information tool. So you've read tuberous sclerosis, multiple body systems, and then you ask it to make this, and you basically, from your knowledge, you can personally validate that, okay, this is correct, and that's great. This is correct. This is correct. This is correct. Okay, this table is correct. I can just basically blindly follow this table now. Okay. Yeah, and I can't underestimate the importance of notes. Personal notes, I think you've probably seen all these notes. So these I would consider notes. These are my notes. This is the way I study. But I've also personally created notes myself from the ground up to help me understand things. And it really helps you to kind of concatenate an entire topic into a page. And if that's the way you learn, it's perfect. So this topic, this was literally like a 2-paragraph thing that I basically stripped it down for parts and put it into one small table. That's what comes up in the 2A. The neurofibromatosis, you've got so many neurofibromatosis points in different body systems. And I just basically drew a diagram and made it that way because I like learning with diagrams. And you've got so many calcifications within the brain that they love asking about based on the location, and essentially making it all putting it all together in one single diagram is really good. And in the end, the ultimate goal with notes is that you should be able to revise the entire syllabus you have studied, which is 2 books of Crack the Core, the night or 2 nights before the exam. And trust me, it makes a huge difference because you might go into the exam center and you've studied all this time, but there's obviously a lot of things which are in your short-term memory or medium-term memory. And if you just refresh your memory the one night before the exam, as much as that it killed me, if you're confident enough with your syllabus, if you've made notes, if you've studied it enough times, you should be able to do that. And if you do that, you feel so much more confident on the day of the exam because now all that information which was in your long-term memory, medium-term memory is also in your short-term memory. And now you could literally like, yeah, oh, okay, I was thinking of tuberous sclerosis. So yeah, that's what happens. Although you might be have able to recall that, but this gives you much more confidence in yourself to go give the exam. Okay. So which is where notes have the most amount of use, I believe. Okay, let me just take a sip of coffee. Any questions till now?
Anime, can I ask how much fact checking did you have to do with ChatGPT, or did you just trust everything that came from it?
It's a good question. So this is what some people asked me as well back when I was preparing. When I was compiling information or summarizing things, there was not much fact checking that I needed to do because I had basically uploaded my Crack the Core core and basically other references, and it was only referring to those. So it wasn't hallucinating as much because I'd given it some really strict principles, or if you just say go to Radiopedia, it tends not to hallucinate. And then secondly, the other usage, which I said for solving questions, if you ask a question that, hey, why is this the answer and not this? It usually doesn't hallucinate, but I don't care if it hallucinates in that case because it helps me understand. If it helps me understand that question and that answer, and it's given it to me in a logical way, I'm happy because that's helped me understand that concept and it's helped me remember the answer to that question. So, in my experience, not too much fact checking. In my experience, not too much hallucinating either. But yeah, obviously, I can't say it's 100% not hallucinating.
Thank you.
Any other questions? Okay.
Sorry, I had a quick one. How important do you think it is to have an up-to-date version of Crack the Core? Because I do have an older version, but I just wasn't sure if there was much difference in like the newer editions.
Yeah, not at all. You don't need the latest version at all. The only updates that he does are usually like 1 or 2 lines, some diagrams here or there. Overall, the substance remains the same. There's not been a major overhaul in the last 4 editions. So if you're within the last 4 editions of the book, I think currently is on edition 10. Jamie has the latest one, I think. But I used an edition which is, I think, 2 years back, 2 versions back behind. But yeah, don't worry too much about editions for any books ever in your entire life, unless there's been a major overhaul. The substance always remains the same.
Brilliant,
The
thank you.
11th is the 2024 edition.
Yeah, so I use the 9th basically. Anything else?
Hi, Tan. I had a stupid question because I'm not as tech savvy as you. So for ChatGPT, did you upload the core or crack the core into one of the windows and you go back to the window for
Yeah.
when you're asking prompts?
Yeah, so basically, you can, if you've got premium, you can create your custom GPTs, which has its own data set. So you can train it on those custom GPTs. So you can upload within that GPT and say, stick to this information, don't go on the internet, and it can do that. But to be honest, it's probably been trained on everything that we have. So even if you don't have premium and you still ask it that, based on core radiology or Radiopedia, make me this table, it will do that quite accurately.
And you use Foro, right?
Sorry?
And
Yeah,
you used 4-0.
Yeah. I think when I started preparation, it was 3-0. Obviously, times have changed. It's 4-0 now. I have my own custom GPT, which is a compilation of all the question books, the good question books, to generate new questions. So I'll share that with you later on in the presentation. So you can access that GPT to just solve questions on the go, and it does a really good job of explaining certain concepts if you get that wrong.
Awesome, thanks.
Cool. Anything else? Oh, cool. That's fine. Okay. So you guys can still see the main screen?
Yes.
Yeah. Cool. So MCQ tips. Like I said, there'll be a lot of times where you've read everything and you think, oh, amazing, I know breast radiology now. At least the kind of theoretical aspect of it. And you start solving questions and you start questioning everything you've ever done. Or maybe that's a unique experience for me. But I think there is an art to solving questions. Again, if you're a genius, you'll get through. But for most people, I think the art of solving MCQs is also quite important because it gives you a platform on which you can confidently approach any question without maybe even having the entire knowledge to solve it. Let's just do some example questions here. So this is a really straightforward one, which to start off with, you could either type it into the chat box or you can shout it out if you know the answer. No answers. Okay, one answer. Yeah, you can tell Dan's done an MCL block, MSK block. Okay, cool. That's fine. So nobody expects you to know this answer. You're about 10 months, 11 months away from the exam. I definitely didn't know the answer to this 10 months before the exam. So let's just break it down, but there's really not much to break down. 30-year-old, knee injury, skiing, MRI shows high T2 signal in the lateral femoral condyle and posterolateral part of the lateral tibial plateau. What does that even mean? But if you know what you're looking at, you'll know what it means. What is the most likely injured soft tissue structure? Now, you could either, this is an example of about 30 to 40% of your exam. This is a straightforward, knowledge-based question that tests a single direct answer. You either know it or you don't. Or you could use a little bit of MCQ technique and forget about everything they've written here, right? Lateral femoral condyle, what does that even mean? I don't know. Forget it. What is the most likely injured soft tissue structure in a 30-year-old who sustained knee injury? What have you heard of? What is the most common injury that you've heard of? It's the ACL. So you could have either come to this answer confidently, knowing what the high T2 signal means, or if you don't know, which a lot of questions in the exam you might not, you just break it down to things that you know. Okay, so 30-year-old, knee injury, most common soft tissue structure injured, ACL. Simple. As I say simple, but it's obviously there's nuance to it. But what I'm trying to say is that there are many ways to approach the same questions. So this is an example of straightforward knowledge-based question. This will be 30 to 40% of your questions. This is an example of pivot shift injury, where basically the way the kind of knee moves when you have a pivot shift injury, you get injury to the posterior lateral corner and the lateral femoral condyle, and therefore you've got high T2 signal, which is bony edema. And in that case, because of the dynamics of how the knee actually moves, you get ACL rupture first, you get other injuries as well, MCL in particular, but the most common injury is ACL, which again is just the most common soft tissue injury of the knee. So basically there are two ways of doing that. Next question. I think this is a very popular question for 2A talks, but I think it definitely elicits an important approach to questions. Okay, so most of you, or all of you who have attempted it, have gotten it correct. Now, that's brilliant. I'm really happy that so many of you know the answer. For a minute, let's assume you don't. Okay, how would you approach this? It's a complex question with multiple things going on. It's sort of a second degree question, but this is going to be a very typical way that the question is going to come up in the exam. Okay, what I would recommend is you read the question and you underline the vital information that's provided to you in that question. This is what I've done. Okay, it's a 19-year-old, shows large mass in the nasopharynx and CT sinuses. Post-contrast images confirmed an intensely vascular mass extending from the pterygopalatine fossa and inferotemporal fossa with forward displacement of the posterior wall of the maxillary sinus. The coronal images show erosion of the base of the pterygoid plate. What is the diagnosis? Okay, so this is a 19-year-old, so you can exclude nasopharyngeal carcinoma. Cool, we've taken that out. Intensely vascular, you know that lymphoma or a granuloma is usually not intensely vascular. Okay, so you can take that out. Erosion of the base, inverted papilloma would explain this, but I mean, it would usually be in the maxillary antrum, but it's still possible. So now it's a 50-50 between inverted papilloma and juvenile angiofibroma. Okay, and now if you go back to the first option, the first line, it says 19-year-old. Fair enough. Seems like it's a juvenile person, juvenile angiofibroma. Okay. What I'm trying to show with this example is that with any question, if you try hard enough or you sieve through the question hard enough, you can bring it down to two options. And when you bring it down to two options, you go read the question again and you find for clues which might point you to either one of them. There will be times where you will get it wrong, but it gives you a much better shot at being correct. And at the end of the day, like I said, the difference between you passing and failing is often the 5 to 8 marks, which you maybe underscore. Okay. This brings me on to the most important single piece of advice that I have gotten personally and I can give you for your exam day. And that's the exam writer is not trying to trick you. Every single thing in that question is relevant to the answer. They are not putting in a 45-year-old with that same scenario with expecting an answer for juvenile angiofibroma. They're not going to do that. A lot of the question banks will have those sort of questions where they're trying to trick you up. They will be trying to, kind of point you in one direction and then point you in the other direction, and then you bring it down to two options, and then it could be either of them. And they just the reason it's C is because the exam writer thought it was C. That's all. It's not going to be that way in the exam. It's quite reassuring if you think about it, because a lot of times people get kind of depressed by looking at the question banks and you're not getting it correct, or you bring it down to two and you're not getting most of them correct. But just remember, in the exam, every single thing in that question stem is relevant. The exam writer is not trying to trick you, because if they have tricky questions, they will be seeded out when they go through the questions. There's a whole panel. There's literally like 10 consultant radiologists who have to, might be exaggerating, but they have to agree on the single answer as the exact answer without any discretion, without any confusion, for that question to be included in your exam. So when you see a question in the exam, just go with what everything fit, with which option all of the things in the question fit. Okay, so write this on your like write this on whatever board you have in front of your studying table, or just on your phone before you go for the exam. Just read this. Okay, it makes a huge difference. Okay, next question. Okay. So let me get, this is a question that I'm going to do a ChatGPT demonstration on, but before we go on to that, let me just sort of break it down and bring it down to at least two options, right? So 53-year-old man, acute left pain and the distribution of the left L5 nerve root, was referred for an MRI of the lumbar spine. MRI revealed well-defined lesion with low signal intensity on T1 images and a high signal intensity on T2. This tells you, I'm sure you know, this means that this is fluid. Yeah. On the lateral aspect of the spinal canal, in loose relation to the L4, L5 facet joint. What is the diagnosis? So most of you have said Tarlov cyst. When you read your two-way material, you know the Tarlov cysts are basically an outpouching at the base of your dura in your sacrum. So it's centrally within the spinal canal, and it's literally at the tip. So they can have compressive effects. They can become big. They can cause bony indentation as well, and compressive effects. But the description is on the lateral aspect in relation to L4, L5. Remember the first rule. The examiner is not trying to trick you. This is fluid intensity. It's not midline. It's associated with facet joint. So it's not a Tarlov cyst. It's not an arachnoid cyst. A neurofibroma would not be fluid density. So you can remove that. You've got two things now. Because it's associated with the joint, it can either be a ganglion cyst or it can be a synovial cyst, right? Now, to be honest, when I did this question, I had no idea what the difference between a ganglion cyst and a synovial cyst is. You could probably infer that synovial cyst is something that communicates with the synovium, whereas a ganglion cyst is degenerative, and it could also show communication, but it's just more degenerative. But how would I differentiate between them? One way you could probably be 53-year-old man, okay, degenerative changes, maybe, but again, both of these are products of degenerative changes. So we've reached kind of a dead end with our rational thinking for coming to a conclusion. You could do 50-50, choose an option in the exam, yes. But say, for example, you're doing this in a question bank. You could basically, what I'm trying to show is you go into your ChatGPT app and you start the voice mode, and then you ask it the question. Hey, ChatGPT, there is a fluid signal lesion in the lateral aspect of the spinal canal in loose relation to the L4, L5 facet joint, which is causing an 53-year-old man some acute pain in the left L5 nerve. Between the ganglion cyst and a synovial cyst, which is the most likely answer and why?
The synovial cyst is more likely in this case. Synovial cysts commonly occur in the lumbar spine, especially near the facet joints like L4, L5, and are associated with degenerative changes. Ganglion cysts are less common in this area. Synovial cysts often cause symptoms like acute nerve pain by compressing nearby structures. This fits with the patient's presentation of acute left L5 nerve pain.
Sound good to you guys? So it does make sense. From what we know about ganglion cysts, we know that they come in the hand. We know that they're in the hand, the foot. Although they're associated with the joint, the synovial cyst is most common in the knee or the spine, and it fits with the patient's presentation. It helps you understand why that is the answer, and it also helps you understand why ganglion cyst is not the answer. So it's a really good kind of a study buddy. If you just keep the voice thing on, you solve your question, and anywhere you're like, why is this the answer? You can ask it that question. And obviously, you can, if you want to read more about it, understand the differences in more detail, you can create a table or go to Radiopedia, understand what the differences are, what they look like. But if you want speed when you're doing questions, which towards the end of your preparation, you will need speed. You need to do about 100 questions a day. This is really good for a quick understanding of why certain thing is an answer and just adding to your kind of internal knowledge base. Okay. I hope everybody heard that. I wasn't sure if my mic's going to cut it out.
It was audible.
Okay, thank you. Cool. The next thing is, well, so where I trained in India, we had something called as IMPs. IMPs basically means important topics. What we would do is we'd take our textbook, we'd go to one of our seniors, and we'd basically they'd just open the book and tick the important topics that we had to read before the exam, because those are the ones most likely to come. Interestingly, I tried doing that with Crack the Core, and basically I was literally writing down every page that came up. So I chose to do something opposite. I chose to basically write down what are the not very important topics, which you don't have to stress too much about, don't spend too much time on, and you can focus on the things that are important, which is basically everything else. Okay. The first thing, nuclear medicine. There is an entire section on nuclear medicine in both core and crack. It's not that important. It's too detailed for the FRCR 2A. There is nuclear medicine concepts and imaging included within the topics. Say, for example, you're doing brain imaging, they have that scan details and stuff like that. If you're doing lung cancer imaging, they include the PET-CT understanding of it within that. So you don't need to go specifically into nuclear medicine in depth. If you feel like you're missing out on something, you can go and understand that topic particularly, but don't go through the entire of Crack the Core nuclear medicine. Breast, there is an entire, like 50% of breast in Crack the Core is American College of Radiology breast guidelines, which obviously we don't follow. So don't worry about that. Just do the first half. And what I would recommend is maybe sit down with a breast radiology trainee or senior who can basically give you an understanding of how the breast clinic is run. You literally need to understand how the triple assessment clinic works and how the breast clinic works, and which views you do. So basically that somebody senior can give you that information in literally half an hour. I tried doing that with our trainees at Coventry. I'm happy to do that again if people would like that. You've also got, I've not mentioned this here, but you've also got obstetrics. Now, obstetrics, again, is a pretty small topic in Crack the Core. You can just do it. It's probably not going to come up in your exam because it's just not too relevant. It's not something that we do, but it's important to learn a few of the values that they look at. But I'm sure you'll figure that out based on the questions that you do. IR, I personally think I'm an IR trainee, and I've read like proper IR textbook, but I personally think Crack the Core is beautifully written for somebody who has no understanding of IR. I think it builds concepts really well. I think it explains to you the concept of catheter, your sheets, how the sizing works, so it's actually more for real life, because if you go into an IR suite and they say, oh, give me a 4 French sheath and a 6 French catheter, and you're like, how is that going to fit? But actually, it's based on whatever diameters they consider. Then I think the Crack the Core IR is really good, which is why I say read it like a story. I personally believe that there are increasing number of questions from IR that are coming up in the FRCR. So I would recommend you read it, but also for important topics which keep coming up, you also learn it in a bit more detail, particularly liver interventions and your vascular interventions. You don't have to worry about the high fancy interventional oncology stuff, etc. But I would highly recommend, even if you're not an IR trainee, to read CTC just for, if you're doing an IR block, etc. So you're not very important. We're coming to the end, I promise. This is all the miscellaneous resources. Have your phones out. There's quite a few QR codes. I personally did spread myself out too thin early on, and I had a long journey of kind of figuring out what works for me, what doesn't work for me. Like I said, I probably wished that I had a bit more guidance, but I think everybody has their own journey. These are resources really good to sort of see if you fancy them, but I wouldn't particularly recommend any of them too strongly. The first one is the ChatGPT two-way question generator. This is a model that I've trained based on all the questions, basically question banks out there, and it doesn't give you the questions from the question bank, but it actually just understands the way that the questions are written, and it gives you these example questions based on that. So we can actually try one out if you like. So ask me a question on neuroradiology, multiple. You could just do neuroradiology, but I'm just going to do multiple sclerosis. So I'm literally just gonna put any answer. I'm not gonna look at it to save some time. And it's also gonna explain if I'm correct or why I'm correct or why I'm wrong. Yeah, so basically I think it's handy if you're literally just traveling somewhere, you want to do 1 or 2 questions. You can't replace the actual questions, question banks, so focus on those, but it's just a handy tool. Okay. Next one is something called RAD Discord. This is a Discord community primarily made of residents from America, but they have people from all across the world, UK as well. And they have a lot of sessions for case discussions, really helpful for 2B learning, but also lots of resources. They have Anki decks if you fancy them. They have books up there. They have the Crack the Core companion image book. They have lots of discussions, etc. So if that's something that you fancy, I would recommend it. I would recommend just joining. Obviously, using and not using is something you can explore. Yeah, my opinion on these 3 things. Anki, I tried using Anki initially because I was a huge proponent. I think I probably gave some of you the talk at the beginning of your SD1 on how to use Anki for your part 1 exam. It was really useful for part 1 because it was straightforward. You see an image, you do the marking. Physics, you could probably do questions. But I think because 2A is so vast and Anki tends to randomize things, it tends to kind of, because they're staggered, etc. I think it's just a bit too chaotic for me to kind of keep it all together. And it was like sometimes I'd go through the deck and I just wouldn't know what I'm looking at, and I'd have to learn it on the spot, and it was not in any context. Like I just need the context. So for if I'm learning the types of renal cell carcinomas, I need to know the whole sort of, the table and the reason why they develop, the risk factors, etc. Anki doesn't do that. It's very factual. And the exam, although it's factual, it relies a lot on your understanding of the topic rather than the factuality. So personally, wouldn't recommend Anki. If it works for you, it's still a great resource. I wouldn't be here if it wasn't for Anki. So that's done. Podcasts. Podcasts are really good for essentially spending your time, which you would have either just listened to music. I mean, depends. If you want to immerse yourself into a prep, go for it. I did podcasts in the last month or a month and a half when I was at the gym. I just listened to podcasts instead of music. Definitely affected my 1 rep max, but otherwise doesn't really. It's a good way to spend your time, which you would have, which normally you would be like, oh, I don't want to go to the gym because I'll lose some studying time. But now you can just listen to podcasts. So there is the podcast which is by one of our consultants from Heartlands, Ulia Malik. So that's Songs for the FRCR. It's a really good podcast. I think she explains things really well, and she explains it in a way that, she's like kind of sitting down with you and she's teaching you. So she's like, okay, we've done these lesions of the brain. I'm going to go through it again because you're going to forget it. So let's do this. And then she'd slowly do it as if she's like trying to road learn it to you. So it's really good. Just explore which ones work for you. There's a lot of American ones, which I don't think are high yield for 2A. But anyway, group study. I think if you like accountability, personally, group study could be considered in your initial days. I wouldn't recommend it towards the end because in the end you need speed. So it's good for accountability initially, not for later on. Well, that's basically my talk. Before I finish, I just want to basically remind you that it's an exam. It's genuinely going to test you. It's going to test the limits of what you can remember, the limits of what you can tolerate, the limits of how much you can study. If you pass, that's amazing. If you don't pass, doesn't matter. You just go up, get up, and give it again. Because at the end of the day, you need to remember you've come a long way from being an ST1. By the time you give your exam, you'll be ST3s. At that point, you are literally at night, you are running the hospital. If you say surgeons need to go and operate, they go and operate. If you say that this patient needs to be escalated to ITU, they are escalate. You're literally at a point where you don't even realize, but you are quite knowledgeable already. And this exam does not determine your self-worth. And I think you need to remember that. Do not sell yourself short. It's just an exam. Screw that person who passed the exam in the first time. Okay, it doesn't matter. You just have to keep at it and you will get through it. All of what I've said is basically my favorite Reddit post that I ever saw on when I was literally feeling so low that I wanted to give up during the exam prep. And it really pushed me through in the last month and a half. This is the screenshot. But while you're reading that, if you could scan the QR code and give me some feedback, that would be great. And I'll take questions, of course. I'm going to assume that you didn't see the ChatGPT question generator. Unless you did. Can somebody just confirm?
we were able to look at it through the QR code that you sent. Is that what you mean?
Oh, okay. Sorry. This is I did a quick demonstration on the on my ChatGPT. So I asked a question on, say, for example, neuroradiology, and it created this question, and then you just give an answer, whatever you think is correct, and it just gives you an explanation, and it also gives you which options and why they're not correct. So that's just a quick demonstration of that. And this is what I used. So for example, I had this open. Let's just go to a topic, pediatrics, let's say that. And I would go to CTC, image references. I downloaded all of that. And I had this on the side. Open. Window. And there. So why is this? So I just go to the top. Right. So say for example, I've started reading pediatrics. Okay. So I go to the first page and it says skull and scalp. And I'm reading pediatrics from the Crack the Core assistant. It says skull and scalp, and the first image is trigonocephaly, which is what they've described here. Trigonocephaly and anterior plagiocephaly. So all the images are linked, and then when I go to the next topic, so cloverleaf syndrome, and keep going down, copper-beaten skull, convolutional markings, copper-beaten skull, Lichtendahl skull, this is here. And then I keep going down, Walmian bones, this is here. So you can just have these side by side. You don't need to have good notes for this, but it's just handy to have this side by side. You could have it on your iPad or whatever, but good notes is what I used.
Can I ask
Okay.
another question, Tammy? Sorry,
Yeah,
it's
of
Oliver
course.
from Stoke. Did you have a different approach to topics if you hadn't done that block yet? Or how did you go about it? So, for example, like if I don't cover breast before the exam, I've never reported any breast, never looked at it. And did you approach it differently or did you do it the same for each topic?
So great question. I'd actually opened this just I think I did want to show you this, but thank you for reminding me. So this is my curriculum evidence summary before I sat the exam. So the green ones show the blocks that I'd completed fully with my sign-offs, etc. before I gave the exam. The red ones are ones that I haven't even started, and the orange ones are ones that I've done, but I haven't gotten all the sign-offs for. So this is approximately what I knew from my clinical training in radiology at the hospital when I gave the exam. I personally don't think that any of that changed my approach to the exam or how I studied things, only because there's a huge difference between reality and the exam. The exam is testing you on common topics, but it's testing your depth and breadth of understanding and in a different way. Whereas in reporting, you're kind of understanding a certain pathology. Quite often, I mean, if you're doing a MSK block, you're seeing lots of knees with whatever ACL degeneration or MCL tears. Nobody's asking you to pick up how things look, whereas your level 4 will be based on, can you pick up those abnormalities and describe it in a report? So I think there's a divide between what we study and what we report in blocks. I think it definitely helps in in grasping the topic much quicker if you've done that block, because you've heard those terms, you're exposed to it, you've been to the MDT. Going to MDT really helps because it helps you understand the management part, which isn't really in any of the books, but you will have questions in it. Obviously, not too many. But otherwise, I don't think it changes much with prep, to be honest.